New at 6, a new alert from the Milwaukee Health Department about an infection spreading rapidly among young children.
It's called shigelossis, and while the symptoms aren't life-threatening, officials warn it is highly contagious. Jonah Kaplan is live downtown. Jonah, how widespread is the problem?
Shannon and Charles, officials at the health department telling us today that the department has sent out more than 60 notices to schools and daycares here in the Milwaukee area since January, and this is the worst outbreak in nearly a decade.
Here's the good news. The infection is easy to treat and easy to prevent. The bad news, the Shigella bacteria can easily spread from person to person.
Person to person by touching other individuals, or it can be spread through what we call fomites, surfaces like desktops, computer keyboards, sharing beverages.
The Milwaukee Health Department describes shigellosis as a bacterial infection that causes upset stomachs, cramps, and a fever. The symptoms can last up to a week. The bacteria is invisible and it first appears in the bathroom. Officials say toddlers are the most vulnerable because they're not potty trained.
And this happens in child care settings. This can happen in certain healthcare settings, especially long-term care facilities, where toileting and diapering occur, right? In child care, kids are learning to become toilet trained, and there's a lot of diapering that occurs, especially for young kids.
Already this year, the health department reports confirmed cases at more than 60 Milwaukee schools and daycare centers. Another vulnerable area, especially in summer, pools.
There's signs all over pools saying, kids, you toilet and wash your hands before you use the pool, and kids with, disposable diapers shouldn't be in the swimming pool.
Besides kids, people traveling out of the country are also at risk, and so are the elderly. Shigellosis is treatable with antibiotics, but officials say the best way to beat it is to prevent it. Proper hygiene.
This is not just a Milwaukee issue we learned today. This is a statewide issue. There are already more confirmed cases of the bacterial infection here in Wisconsin in 2016 than all of last year combined. We are live here downtown. Jonah Kaplan, today's TMJ4.